this meeting. So I'm a clinical neurologist. I'm an adult clinical neurologist, and I work for the Human Genome Research Institute in Bethesda. And my experience on late onset Tay-Sachs and Sandhoff's disease stems from my work the last 10 years, seeing patients as part of a natural history study being conducted at the NIH. And many of the people in the audience very likely have heard about it or have participated in the study. In terms of the medications do's and don'ts, that actually becomes a relatively easy aspect to discuss, because in reality, there are no approved medications for late onset Tay-Sachs or Sandhoff's specifically. But it is important to keep in mind that these diseases are complex, and that the symptoms which they present not only could vary, but also could change over time and could be compounded by other aspects of the disease process. And that is important to keep in mind all these different aspects as one moves through the process of taking care of patients with late onset Tay-Sachs and Sandhoff's. So the basic objective here is to outline some of the guiding principles. Again, I'm not going to talk about necessarily medications because they are non-specific, but there are some general guiding principles that would be helpful to discuss and be the subject of further questions in the later part of the session, as it relates to how to look after patients with late onset Tay-Sachs and ensure that they have as productive and as happy and I'm sorry, something I did here did not agree. There you go. So that I'm going backwards. For some reason, I lost my there. So, and a lot of this is common sense and is primarily intended for me to serve as a reminder that I wanted to talk about some aspects and also to open some lines of discussion that we can address in the question answer if we have the time. First of all, when thinking of these rare diseases, there is a tendency to sort of convert or direct your entire experience directly to the disease. But it's very important to think holistically, think about the entire organism, both physically and mentally, from the perspective of well-being. It's very important to keep in mind that that if we become hyper-focused on, for example, one of these conditions, that we are not necessarily immune to conditions that are relatively more common and could be actually potentially even more severe. So we can think about hypertension, diabetes, obstructive sleep apnea as very significant risk factors for cardiovascular disease and stroke. We have issues related to anxiety, insomnia, etc., that are conditions that could be treated and that when treated could have a substantial impact on quality of life. Is very important, and I saw a question about hydrotherapy is very important, and I think this is a point that I always like to make to my patients is optimize fitness. And I always tell my patients, think of fitness pretty much like a medicine. And you take medicines with water or with a shot, but fitness and exercise and conditioning is also a medicine that you take with time rather than with water or with injections. So I would certainly encourage all my patients to pursue a program of fitness, and sometimes even to consider the possibilities of having a personal trainer, proper physical therapy, guidance, and so forth. Optimize sleep quality. For example, sleep apnea is relatively prevalent in many of these conditions and affects multiple aspects of well-being. Seek medical care early. There are patients whom may benefit from, for example, an assistant device or a scooter, and you don't want to wait until you have a broken bone or you already had accidents to actually seek for care at the proper time. Nutrition is very important. It's important to think that with these rare diseases, you could benefit from the things that have already been proven to be helpful in other conditions that look like late onset of Tay-Sachs. For example, ataxia is a relatively common symptom in late onset, and there are a number of strategies that have been proven to be beneficial, for example, in the management of tremor, in the management of instability in patients with other forms of ataxia. So piggyback on some of those based on the prevalence and the severity of some of the symptoms associated with these disorders. Teamwork is very very important. You know, this involves the family, involves friends, and one cannot underestimate the benefit of the advocacy, in particular, in this case, NTSAD, providing the forum for people to exchange ideas and exchange advice. Participate in studies, and I know Dr. Lau is going to talk about studies in particular, but even natural history studies that are non-therapeutic can provide the basis for developing what is the expected progression of diseases, so that when the therapies become available, we already have some understanding of what is expected in the untreated state. Get your COVID vaccine. Benefits far outweigh the risks. Now, in terms of things that we don't want to do, not all symptoms are due to late onset Tay-Sachs, Sandhoff's. So listen to your body. Common sense avoidance of things that are known to be deleterious. For example, of course, smoking, excess use of alcohol, some medications. When you get a prescribed a new medicine, you may want to ask the doctor that this medicine has the potential to be toxic to the peripheral nervous system. Can this medication have the potential to producing toxicity to the cerebellum? Those are things that you want to know ahead of time. Don't fall prey for, you know, there's a lot of basically unfair marketing and very aggressive marketing for therapies that look too good to be true, and always take that with a grain of salt. There are some psychotropic medications, and psychotropic medications are medications intended to manage psychiatric symptoms that could be present in some patients. And there is some, at least some experience suggesting that some of the older medications of the family of, for example, Haldol or risperidone or chlorpromazine may actually have a negative effect on the function of lysosomes, and as a result, potentially augment the symptoms or the speed of progression of symptoms in this group of diseases. And more than anything, I wanted this as an opportunity to have the group ask additional questions. I don't know if I used all my time, but I would be delighted to actually have the opportunity to exchange some questions and comments and experiences from the audience. And I really thank you for participating, and I thank the NTSAD for having done, putting together this meeting and for inviting me. Thank you.
Great, thanks, Camilo. We have one question that's come in. Do psychotropic and other medications have adverse effects on individuals with late onset Tay-Sachs or Sandhoff? And
so the answer to that question is that it is believed, and there is some data derived from clinical studies that suggest that some of the older psychotropic medications could have a deleterious effect on the basically influencing adversely the progression of these disorders. So those older psychotropic medications that are called first generation antipsychotic medicines, for example, should be avoided. Now, there's a whole new generation of medications that are called atypical antipsychotics, and there is really no actually data to indicate one way or another. But so if somebody needs to be in a psychotropic medicine, ideally be in one of the newer generation medicines rather than the older generation medicines.
Great, and I know your talk was on medications. Another question had to do with diet. Any dietary recommendations?
Yeah, so it's an excellent question. I think to this point, there is no evidence that any particular diet is better or worse for this particular condition, late onset Tay-Sachs, I would say that studies indicate that the best idea will be to follow diets along the lines of Mediterranean diets. I think weight control is very important in this disease because as patients begin to experience some of the degree of lower extremity weakness, that weight control actually becomes a strategy that could help improve the level of function and decrease the strain on the joints and the muscles that could have an adverse influence.
Thanks. I think you answered this next question already, but in terms of recommended, in quotation marks, antipsychotic medications, one participant has mentioned Seroquel extended release as being beneficial. Is this do you think this could be a general benefit to patients, or is it really every patient needs to try out their own type of medication?
Yeah, my intent is basically to speak in generalities, but I would say that Seroquel belongs to the newer generation of medications, and if for this particular individual it has been beneficial, I will certainly encourage to continue using under the supervision of the prescribing physician.
Right. Okay. Thank you so much, Camilo. I think we'll move on